Welcome to a deep dive into the world of eating disorders and obesity. We've got some fascinating sources for this one, like a medical handbook, some pretty intense research papers, even some stories from clinicians who work with these conditions every day. By the end of this, you'll have a much deeper understanding than what you usually see in the news.
It really is about going beyond those simple explanations.
Mhm.
Appreciating how complex and nuanced these issues really are. They touch so many lives, but there are so many misconceptions out there.
That's exactly why we're doing this,
Right.
to dive deep and unpack it all. So let's start with something that might surprise you. You know those distinct categories we always hear about: anorexia, bulimia, binge eating. Well, our sources suggest that these categories might be more fluid than we think. It might actually be more helpful to think of them all as points on a spectrum.
Yeah, the lines between those diagnoses can be surprisingly blurry. For instance, did you know that something like half of all people diagnosed with anorexia nervosa actually go on to develop bulimia at some point? I mean, it really challenges the idea that these are totally separate things.
So it's like these categories are kind of artificial,
Yeah.
right? And it doesn't stop there. The research even suggests that many people experience what are called partial syndromes, meaning they have some characteristics of one eating disorder and some of another. So instead of like fitting neatly into boxes, it's more like this complex web of symptoms and experiences.
Exactly. And that complexity also shows up when we look at how these disorders seem to be, well, on the rise, especially in Western nations over the past 50 years. There's a noticeable increase in anorexia and bulimia diagnoses. And what's interesting is this happened at the same time as a decrease in hysteria diagnoses.
Okay, now that's interesting. So is this a real increase?
Hmm.
Or is it just that we're, perceiving these issues differently now? I mean, we're way more aware of mental health than we were 50 years ago.
That's the million-dollar question. Some experts think that, well, societal shifts, especially the huge pressure to be thin, could be driving this apparent increase. Like the culture itself is sort of contributing to the problem.
That makes sense, but it can't be the whole story, right?
Yeah.
I mean, cultures are so diverse, even within a single country. What about the global picture? What do our sources say about that?
Now that's where it gets really fascinating. There are all these intriguing geographic and cultural variations in eating disorders that, will they really complicate the picture? Like, why are rates higher in the USA compared to Europe? Or look at the case of Black South African girls. They had a surge in eating disorders after apartheid ended. These global patterns really challenge those simple explanations.
It's like the same puzzle, but with pieces scattered all over the world. Okay, so let's focus in on one piece of this global puzzle: anorexia in Hong Kong. What stood out to you about this?
Well, in the West, we often associate anorexia with an intense fear of fatness, right? But in Hong Kong, that doesn't seem to be the driving force. And that really challenges some of our basic assumptions about anorexia, like how culture shapes its expression.
So it completely flips the script on what we think we know.
Hmm.
Okay, so we've talked about cultural factors, but what about biology? How much do our genes influence our vulnerability to these conditions?
Well, twin studies have shown that genes actually play a huge role. Get this, the heritability of anorexia is actually higher than the heritability of type 2 diabetes. The estimates are between 58 to 76% for anorexia and 31 to 83% for bulimia. That's a pretty strong genetic influence.
Wow, that's a big number. So it's not just about willpower or making better choices. There's this biological piece we can't ignore. But our sources mention that we're not talking about a single eating disorder gene, right? There's the whole array of genes linked to both eating disorders and obesity. What can you tell us about that?
Yeah, there are actually quite a few genes that researchers are looking into, each one playing a role in different and complex ways. For instance, the 5-HT2C receptor gene has been linked to obesity. And then there's leptin. It's a hormone produced by fat cells that's supposed to regulate your appetite. In studies with mice, when they don't have enough leptin, it leads to, well, they basically eat nonstop, a condition called hyperphagia. And that ultimately leads to obesity.
So their body isn't sending them the right signals. They don't know when they're full.
Exactly. It really highlights how intertwined genes, hormones, and behavior can be in these conditions. But of course, it's not all about biology. Our psychological makeup and our early experiences, those play a crucial role as well.
Okay, so let's move beyond the physical. Let's delve into that psychological landscape of eating disorders. Where do our sources suggest we start?
Well, it all begins in childhood. Those early relationships we have with our caregivers, they actually can have a big impact on whether we develop an eating disorder later in life.
So those early relationships can shape how we relate to food and our bodies. I'm curious to hear more about that.
Okay, so imagine this. In childhood, we develop these mental blueprints for relationships, kind of like a template. We call these internal working models. But if those early relationships were insecure or inconsistent, those blueprints, well, they might not be so reliable.
So if our early attachments were a little rocky, that could make us more vulnerable to developing problems with food and body image down the line.
Precisely. And there's actually research to support this idea. One study found that a striking 95% of anorexia nervosa patients and 83% of their mothers had insecure attachment styles.
That's a pretty powerful statistic. It suggests that these vulnerabilities can get passed down through generations, almost like a cycle that's hard to break.
Right.
But attachment isn't the only factor, right? Our sources also talked about cognitive processes, specifically schemas. Can you explain that in simple terms?
So schemas are like these mental frameworks that we develop, and they shape how we interpret ourselves and the world around us. For example, if someone has a schema that says thinness equals worthiness, that can fuel and maintain an eating disorder.
So it's not just fear of weight gain, it's this deep-seated belief that your value as a person is tied to your body size.
Exactly. And these schemas can be incredibly strong, really hard to change. They drive those distorted thought patterns we see in eating disorders. But, it's important to remember it's not all about fear and distorted thinking. There are other emotions at play here too, emotions that are often overlooked.
Okay, I'm listening. What other emotions are we talking about?
Well, our sources, they encourage us to look beyond fear and consider the roles of shame and disgust in these conditions.
Shame and disgust. Those are pretty intense emotions. How do they fit in here?
Well, think about it. Eating disorders often involve a lot of shame, right? Shame about your body, shame about your food choices, shame about eating behaviors. And research has actually found that people with eating disorders are more sensitive to recognizing disgust in other people's facial expressions. Like they're picking up on those subtle cues more readily.
Interesting. So they're more attuned to those external expressions of disgust.
Hmm.
And that might then trigger or amplify their own internal feelings of shame.
That's the idea. And it's not just speculation. Research has shown that just being prone to shame is linked to eating pathology. And actually, some researchers think that shame might be the missing link, the bridge between those difficult childhood experiences we talked about earlier and the development of an eating disorder later on.
So it's not just about fearing weight gain. It's about this deep shame that's often woven into these disorders, sometimes stemming from those early relationships. That's heavy stuff.
It really underscores the deep psychological impact of these conditions. But we also can't forget about the medical reality. These are serious conditions with very real and sometimes life-threatening consequences.
Right. This isn't just about fitting into a certain size. We're talking about someone's health and, in some cases, survival. So let's shift gears a bit and talk about the medical side of things. What are some of the key complications that stood out in our sources?
One of the most concerning ones, especially for people with anorexia nervosa, is osteoporosis. It's where your bones become weak and brittle, which obviously makes you much more likely to break a bone. It's basically a direct result of malnutrition. When your body's not getting those essential nutrients, it starts breaking down bone tissue to compensate. And that can have some pretty devastating long-term effects.
Yeah, I knew osteoporosis was serious, but I didn't realize it was so closely tied to eating disorders. What else should we be aware of?
Well, another really concerning one, especially during the early stages of recovery, is something called refeeding edema. So imagine someone who's been restricting their food intake for a really long time, and then they start eating again. Their body kind of goes into overdrive trying to replenish itself.
Makes sense. But what exactly is refeeding edema, and why is it dangerous?
It's basically a really rapid shift in fluids and electrolytes, which causes a lot of swelling, especially in the hands and feet. Now, it's not actual fat gain, but it can be really distressing for someone who's already super sensitive about their body image. And in severe cases, it can even lead to heart and lung problems.
So it's like their body is so depleted that it can't even handle the nutrients properly.
Exactly. And then you have the electrolyte disturbances that can happen from purging behaviors, like vomiting or laxative abuse. One of the most serious ones is hypokalemia, which is a low potassium level.
Right, I've heard that it can be really dangerous, right? Even fatal in some cases.
Absolutely. Potassium is essential for your heart to function properly. And when it gets too low, it can lead to cardiac arrhythmias, which can be, fatal.
It's a good reminder that we're not just talking about, food and weight here. These are complex medical conditions with with really serious implications for a person's overall health.
Precisely. And while we've been mainly focusing on eating disorders, it's important to remember that obesity also has its own set of medical risks. Things like heart disease, type 2 diabetes, even certain types of cancer, they're all more common in people who are obese.
It's about recognizing that both ends of the spectrum, so to speak, have their own unique challenges and health concerns. It's not about judging or placing blame. It's about understanding the complexity and providing appropriate support.
Couldn't agree more. It's about promoting health and well-being for everyone, no matter what their size or their relationship with food is like.
Okay, so we've talked about the spectrum of eating disorders, the biological and psychological factors, the global variations, and the medical consequences. Phew, it's a lot. But now I want to know what we can actually do about this. What are some of the more promising approaches to treatment and prevention that you came across in your research?
Well, there's no magic bullet, unfortunately. These conditions are, as we've seen, incredibly complex, and treatment really needs to address both the psychological and the physical components. But there are some interesting new developments in the field. One approach that's gaining traction is something called motivational interviewing.
Motivational interviewing. I've heard that term before. Can you break it down for our listeners? How does it work, especially with someone who has an eating disorder?
It's a pretty collaborative approach. So the therapist isn't telling the patient what to do. Instead, they work together to kind of explore the patient's own reasons for wanting to change. It's about helping them figure out what their values and goals are and then connecting those to their recovery.
So it's less about imposing a strict treatment plan and more about empowering the person to make changes themselves. I like that. What about other therapies? I know CBT, cognitive behavioral therapy, is often used for eating disorders. Can you tell us a bit about that?
Sure, CBT is a very effective approach that focuses on changing those unhelpful thought patterns and behaviors that contribute to the eating disorder. So, for example, someone with anorexia might have these really rigid rules around food and exercise. CBT helps them challenge those rules and develop more flexible, healthier coping mechanisms.
So it's like giving them concrete tools to manage their thoughts and behaviors. And early intervention is key, right? The sooner someone gets help, the better their chances of a full recovery.
100%. Early intervention is absolutely crucial. And that's where the stepped care model comes in. Basically, this approach tailors the intensity of treatment to how severe the person's symptoms are. So, someone with milder symptoms, they might do well with something less intensive, like group therapy or nutritional counseling. But for someone with more severe symptoms, individual therapy, inpatient treatment, or even medication might be necessary.
It's about meeting people where they're at and providing the right level of support at the right time. And it's not just about individual therapy, right? Families play a huge role in all of this as well.
Absolutely. Families can be a tremendous source of support, but they also need support themselves. It's really important to recognize the burden and the stress they experience when their loved one is going through this.
Like a ripple effect,
Right.
The individual struggles impact the whole family system.
Exactly. That's where family therapy can be so valuable. There's this approach called externalizing the illness that's particularly helpful for families dealing with anorexia. It basically helps them separate the person from the problem and communicate better. So instead of, blaming each other or fighting, they can work together as a team to support their loved one.
I like that analogy. It's not about pointing fingers, it's about uniting against a common challenge. But support shouldn't stop at the family level, right? What about the role of the community in all of this?
Community-level interventions are absolutely essential, especially when it comes to prevention. We need to create environments that promote healthy body image and healthy eating habits for everyone. That means challenging those cultural messages that tell us that being thin equals being worthy. It means promoting a more holistic view of health and well-being.
It's about shifting the focus from shame and restriction to self-acceptance and nourishment.
Exactly. And there's research that suggests that these broader community-based approaches can really make a difference. One study found that long-term ecological programs, like those that involve teachers, health professionals, parents, and students, were much more effective in preventing eating disorders than those short-lived interventions.
So it's about building this web of support that goes beyond the individual and the family. A web that encompasses schools, healthcare providers, the whole community. It's about fostering a culture that values health and well-being in all its forms.
That's the ultimate goal, and it's something we can all contribute to.
That's so well said, and something we need to hear more of,
Hmm.
moving beyond, blame and judgment and toward compassion and understanding.
Absolutely. Recognizing the person behind the struggle.
This has been a truly eye-opening deep dive. I feel like we've covered so much, and I personally have a whole new perspective on eating disorders and obesity.
I'm so glad to hear that. It's been a pleasure exploring all of this with you, and I hope our listener feels the same, informed and maybe even a little empowered.
Me too. But before we wrap up, let's do a quick recap for our listeners, just to solidify all those key takeaways. You ready?
Let's do it.
Okay, so first, we kind of busted that myth of simple categories, right? We talked about how eating disorders actually exist on a spectrum, from anorexia to bulimia to binge eating disorder. We even touched on obesity. And these categories aren't fixed. There's a lot of overlap, as well as what are called partial syndromes.
Right. We also talked about how rates of eating disorders seem to be increasing, especially in Western cultures over the past, 50 years. And we discussed how those cultural pressures to be thin might be playing a role, but it's not just a Western thing. We saw how eating disorders can look really different across cultures, which really challenges those simple explanations, right?
And then there's the biology. We learned that genes and hormones can have a huge impact on both eating disorders and obesity. Remember that stat. Your chances of having a genetic predisposition to anorexia are actually higher than your chances of developing type 2 diabetes.
Yeah. And we can't forget the psychological piece, all those crucial early experiences, those attachment styles we develop as kids, the schemas that shape how we see ourselves in the world. Those things all matter.
And then we dug into those other emotions, like shame and disgust, that often get overlooked when we talk about eating disorders, really highlighting that emotional burden.
And of course, we can't forget about the medical side of things. Those very real medical consequences that come with both eating disorders and obesity. Osteoporosis, refeeding edema, electrolyte problems, higher risks of chronic diseases.
Right. It's not just a lifestyle choice. It's a complex medical situation that needs a multi-pronged approach to treatment.
Absolutely. And we talked about all these exciting developments in treatment and prevention, the importance of personalized approaches addressing both the mind and the body, things like motivational interviewing, cognitive behavioral therapy, family therapy, community-based interventions.
And we talked about why catching things early is so important. That stepped care model that makes sure people get the right level of support depending on how severe their symptoms are.
And of course, we emphasized how crucial family and community support is. Recovery isn't something you have to go through alone.
So well put. We've given our listeners a lot to think about today. But before we sign off, I want to leave you with one last thought. Given everything we've discussed, what can you do as an individual to help create a more supportive environment that promotes healthy body image and eating habits for everyone? It's something to really think about.
It is. Remember, change starts with awareness and compassion and a willingness to challenge those harmful norms that are out there.
Well, thank you so much for joining us on this deep dive into the world of eating disorders and obesity. We hope you found it informative, insightful, and maybe even a little inspiring.
And remember, there is hope, there is help, and recovery is always possible.